It is my pleasure to request our Honorable Chief Nursing Officer, our leader and mentor, Dr. Monet, to address audience for welcome remarks.
Good morning, everyone. I would like to welcome you all to this special guest lecture on patient-centered quality and patient safety. Most especially to our distinguished colleagues and speakers from the UK delegation. And of course, all our nurses present here, both senior, nursing managers, and below. We know that you have traveled so far just to give us all your valuable time, and we really appreciate it. I just want to tell the audience how this collaboration came into. Basically, you know that we have our new NAS nursing manager, Mr. Salman, and during my first, actually, meet and greet, he was telling me that, Ma'am, there will be some delegation of the UK nurses, and they are going to Taxila. So then he actually mentioned Dr. Barbara Farfit, and I had actually had more interest because I said, oh, Barbara. Sorry, Barbara, you're not here, but I asked them to, tell this story. So I have actually met Barbara in Bangladesh, where I was before the Chief Nursing Officer of Apollo Hospital in 2008, and then came back to Bangladesh again in 2013. From 2008 to 2012, I've been to Bangladesh in Apollo Hospital as CNO, and then another JC accreditation in Vietnam. So I took chance to help Vietnam, the Vinmec International Hospital, for the Joint Commission accreditation. And it so happened that Bangladesh heard that Dr. Monet already left Apollo. So I went back to United Hospital, where Barbara, together with the Grand Caledonian School of Nursing, have the collaboration. So they are bringing the students for clinical practices there. And Barbara would invite us, for some topics that enhances the nursing professionalism and the like. And I would love also to invite her in our hospital. So, and then I thought I would meet her by this morning, but of course she will come a little bit later. But when I joined Shefa in 2016, a year after, I met her in one school where they were discussing about midwifery contents. So I met her and I said, oh, a small world. Okay, that we nurse leaders really met each other when you have a common goal. And the common goal is, of course, to create awareness. Though I know you are more learned than us, my dear audience. But then, of course, to create awareness and enhance your knowledge, attitudes, and skills are our main focal point in each of nurse leaders. So when I met Gwen today, this morning, in my office, so she was really passionate on how you will learn from her expertise. And I said, you don't worry, the nursing managers are really very eager to meet you and the nursing staff. So because of Salman's insistence, actually, but Ma'am, they will be coming to Taxila, would you like to invite them here? So we then push forward to the senior management, and then you are here now. So I would like to personally welcome both of you, including Barbara, in this wonderful hospital where I'm enjoying here for more than 5 years. And I would love you to, engage you that Pakistan is really a beautiful country with lovely people and genuine people. They love also family. They are family oriented. So that's why I would not miss Philippines, because they are same with our culture, a peace-loving people, especially here at Shefa. So I did not have problems actually coping with them. And they are really, very easy to learn people. When you teach them, tell them, or ask them also their opinions, they are very willing. So I would ask the audience and show them that my Pakistani nurses are alive and kicking. That means you will undertake them, you will let them feel that you are interested, because I know that's why your presence coming here is a note that you're interested to really interact. It's actually an interaction that we would like you to have. Okay, so it's actually a multicultural exchange of experiences. So this is what I look into. Okay, so of course after the lecture, you are free to question Gwen, and of course Gwen, I know, would be lovely to answer you good questions. So without much delay, sorry for a little delay of our program, but I know they would love to stay with you, okay, for the rest of the day. So first and foremost, of course, I would like to congratulate the first project of the MES for making this possible. Can you please give a round of applause to Salman? Okay, Salman haven't known Dr. Monat that I'm always love and always facilitating nursing education and training. And I would like also to introduce our lovely lady there, my senior nursing manager, who is part of our infection control team. So she would always invite me to do the welcome remarks whenever she will visit the room. So she's role. She introduces a lot of infection control practices in our hospital. And for that, we have gained 2 accreditation and reaccreditation from Joint Commission International. So thank you so much. Of course, with the nursing managers here, Tamina, who ran the show in the MES, when Salman is not yet available, and the rest of my team. So thank you so much. It was a lovely morning meeting you, and good luck to a fruitful discussion. Once again, welcome.
In discussion with you. I don't know how many of you have ever been ill. Hands up, anybody who suddenly felt ill and needed medical care of some kind. I've had a couple of hip replacements and a knee replacement, and you know what it's like. And you know that feeling of suddenly being totally reliant on the medical staff. You feel as if you've lost all your own power and influence, and you're dependent on them. Now that has to change. Patients have to be able to be engaged with their care. And I think in the presentation you got this morning, you heard about the benefits of that. It's part of this quality agenda. And if you don't have patient-centered care, you will not have sustainable change and sustainable influence. So it's not about empowering yourself as a professional. It's about empowering your patients. And when I did my PhD many, many years ago in the 1980s, I was very interested in this whole topic. And I looked at what it was that influenced that power engagement. And I found out it was about knowledge. I know something you don't know. I will tell you when it suits me, rather than I know something you don't know, and I'm going to give you all the knowledge I have so you can make the decision. That was one of the key factors. So I'm not going to say any more. You've had a lot of sessions this morning, and maybe you've got one or two questions. I think someone you asked about that.
Right. So there was a question about difference between patient-centered care and person-centered care. They seem very similar, but is there a difference? And if there is, then what is it?
I think for me the difference, we often talk about patient-centered care, but immediately you use the word patient health. Actually, we're talking about person-centered care, and that not only means the person who we are caring for, but it means their family, their relations, their children. Person-centered care is the package. And in Pakistan, even more so than probably in Europe, the family to the health. Think about everybody. So person-centered care is a person. And that person has a family, has a husband, has children, has money problems, has travel problems, has a job or doesn't have a job, is poor, is rich. You know, there's all that stuff that makes me a person. Patient-centered is your illness, it's your disease, it's what's wrong with you while you're here. But when you've gone, so be it. So I think that's the distinct difference.
That's wonderfully explained. Thank you so much. I think there was another question, although Gwen has already gone over it, but we would like to hear your perspective. From oncology, there was a question around palliative care. So what is the importance of person-centered care in the palliative care services? How does it become more important?
I think it's very important. I think it's important at any stage of anybody's medical journey or medical history, but palliative care particularly, because we have the privilege and the honor. You are providing spiritual care. You are there for them through their faith journey as well as through their physical journey. And it's about supporting them and their family to make their end a good one, a positive one where they still have hope and they're looking towards their spiritual regeneration, however they interpret that. And we all have our different faiths and ways of explaining it. But that is your responsibility, and it's a big responsibility in terms of how you provide support and care. Palliative care for me is one of the most